Just a little bit about our webinar today. The health communication resources to support your tobacco control and prevention goals is presented by CADCA's Geographic Health Equity Alliance in partnership with CDC's Office on Smoking and Health. This webinar will discuss the role of health communications in supporting tobacco prevention and control goals, and will familiarize attendees with CDC's Media Campaign Resource Center. The webinar will guide participants on selecting evidence-based, effective tobacco counter-marketing ads, and will include examples of how state and local groups have built health communication efforts using the free to low-cost materials in the MCRC. CADCA's Geographic Health Equity Alliance, or GEA, is a CDC-funded national network dedicated to reducing health disparities related to tobacco and cancer. GEA's focus is on reducing geographic health disparities, which they define as the differences in health behaviors, outcomes, and policies related to where people live, work, and play. For more information about GEA and promoting health equity, please visit geohealthequity.org. And so quickly, I will introduce today's presenters. We have Dr. Kimberly Lane, who is the MCRC lead in the Office on Smoking and Health, Susan Airhouse, the MCRC administrator and ICF Next for CDC/OSH, Office on Smoking and Health. Excuse me, I'll put $1 in the acronym jar. Amy Layer, who's the MCRC backup, Office on Smoking and Health, and Renee Nolan Rosenkrantz, who's the Media Network lead at the Office on Smoking and Health. And so without further ado, I will turn it over to Dr. Lane.
Great, good afternoon. If you can advance the slide, please. So I want to thank you first for inviting us. Today, we're excited to share with you the many resources and materials that we have to support your tobacco prevention and control efforts. So here's what we'll be covering today in our presentation. First, we'll talk about the role of health communications in tobacco control, and then we'll transition to tell you about our Media Campaign Resource Center, better known as the MCRC. We will walk through the MCRC to help you navigate the interface more easily. Next, we'll share guidance to help you select ads that are evidence-based. We'll also share other materials and resources from the Office on Smoking and Health and CDC to help you so you'll have everything you need for your health communications work. Now, I'll transition to my colleague, Renee Nolan Rosenkrantz, who will talk about our first topic, the role of health communications in tobacco control. Renee?
Hi, thank you so much, Kim. Can you hear me?
Yes.
Great, thank you. So wonderful to be here with you guys today. So go ahead and getting started and diving into this topic. So first, next slide, please. Thank you. We want to just start out by saying that an important piece of a comprehensive tobacco control program is really a strong health communications program, and there have been many studies that have shown this. So, and we thought it would be helpful to just kind of lay the groundwork first before we talk about the actual resources. So CDC has sort of what could be easily referred to as a tobacco control playbook called Best Practices for Comprehensive Tobacco Control Programs, all based in peer-reviewed literature. And this guidebook recommends mass reach health communication interventions as powerful tools for preventing the initiation of tobacco use, promoting and facilitating cessation, and shaping social norms related to tobacco use. Health communications help achieve tobacco control goals by building support for policy and program efforts, countering the tobacco industry advertising and promotion, and reaching large audiences that help shift social norms around tobacco control or tobacco use. So, the point is that health communication interventions work best when they're developed to strategically support the goals and activities of a program. They don't exist in a vacuum. They're most effective when deployed strategically to help you achieve your overall goals. So we like to use this metaphor of a tobacco control vaccine because we know what works, and hard-hitting media campaigns are one of the ingredients to this vaccine. And the vaccine components and its booster shot, which we show here, are outlined in our best practices guide that I just mentioned. So next slide, please. So here we are talking about goals. So let's find out what your goals are. So we're going to pull up a poll here. Thank you very much. And we want to, let's see. Yeah, pull up a poll here. Thank you. And we want to know what your tobacco control goals are. So what tobacco control goals are you working toward? Are you working toward youth prevention, promoting and supporting cessation? Are you working on flavors, point of sale and retail, smoke-free protections? Let us know. If you're not working on any of these goals, if there's an other, please let us know what you're seeing in the chat, and I'll take a minute to drop into the chat and see what's there. Okay. And all right, thank you for publishing those results. So a lot of you are working on youth prevention and also a fair amount on promoting and supporting cessation. So, okay, very, very helpful. Smoke-free protections to an extent, as well as point of sale and flavors. Okay, wonderful. Thank you so much. That's really helpful for us to know so that we can sort of tailor some of the resources that we might highlight according to what you're working on. So next slide, please. Okay, so now since we've already talked about how media and communications doesn't work in a vacuum and is most effective when it's there to serve your broader tobacco control goals, which for many of you is going to be youth prevention. So where do you start? So you can start here, this guide on this slide. So CDC published, our Office on Smoking and Health published a user guide to accompany the best practices guide I mentioned earlier. And this guide can help you develop and implement different kinds of health communications, including paid media ads and social media content. It can help you learn from real world campaigns, including examples of programs that have very limited resources and are still doing excellent and successful media communications work. The guide also makes the case for investing in effective health communications to partners, the public, and other stakeholders. And it'll help you identify resources and tools to help plan your efforts. So this guide provides a helpful foundation for your efforts at the state and local levels. And this slide details the specific topics that are covered in the guide. And we can also include the link to it in the chat. It lives on the CDC OSH website. Next slide, please. So I know when we're talking about media, you might be thinking about paid campaigns, but you really don't need lots of money to do local media and health communications work. So many of the ideas we're going to talk about today are low or no cost. And the Media Campaign Resource Center has plenty of free materials you can use to support this work. So firstly, earned media is a vital tool that can help change social norms and build support for tobacco control. So this can include writing letters to the editor, or writing opinion pieces, or pitching a story to a reporter, holding a press conference or an event that might attract media attention, or asking local media outlets to run public service announcements, also called PSAs. So earned media is called that for a reason. It doesn't cost any money, but you have to earn the coverage, which takes time and energy. Next slide, please. And if you're going to be doing earned media, it's a really good idea to go ahead and pull together visuals or graphics to have those ready to share with the media. You want to try to steer them away from using the usual images of someone smoking a cigarette or an ashtray full of cigarette butts. So this slide right here lists lots of resources where you can get free visuals and graphics to build a collection of materials to support your earned media work. And just as an example, instead you would want the media to use something like a visual that has local data in it, or images of nicotine replacement therapy products, instead of an image of a person smoking. So next slide, please. So speaking of localizing, if you localize your communications, this really does increase the chance that the media is going to pick up the story, or that a local partner or a decision maker who hears that story is gonna find an issue relevant. So to prepare for any earned media and communications work, we encourage you to pull together local or state data about things like smoking prevalence, tobacco-related diseases, quit rates, quit line usage, healthcare costs, and any policies that create environments that support cessation and youth prevention. So you can use this data to provide the local angle when approaching the media, and then also use it in your general communications as well. So CDC, as well as several of our partners, have a wide variety of local and state data sources you can tap into to localize. So they're all outlined on this slide. And so I just in particular want to point out the Office on Smoking and Health's state system and the Robert Wood Johnson Foundation's county health rankings and roadmaps. And all of these on the slide are hyperlinked. So when we share the slides after the call, you'll be able to click here to click on them, to get straight to the resource. Next slide, please. And one more, thank you. And another low cost idea that you may already be taking advantage of and likely are, but is to piggyback on holidays and health and heritage observances to promote tobacco control and prevention messages. So you can use a holiday or an observance as an opportunity for social media, which is probably the biggest one you guys might be doing, as well as you can use it as an occasion to partner with an organization and to reach out to a reporter with a story. The MCRC, which you'll hear about later, has lots of free social media images that you can use in this work. And I'll take this quick opportunity to make a plug for making an editorial calendar so that you can plan out several months or a year at a time which observances and events you want to leverage. And we're also, by the way, going to include a list of holidays and observances that you can consider leveraging in the realm of tobacco prevention and control. It'll be one of our handouts that are sent out after the webinar. Next slide, please. So since we're talking about where to get resources and the CDC has a lot of them, we're curious where you are currently getting your resources. So we are, we'd like to know, we're going to do another poll here. If you are using social media or placing any PSAs, where do you get those images right now? Are you getting them from a partner? Are you getting them, from, CADCA and Geographic Health Equity Alliance? Do you already get them from MCRC? We're just curious where you're getting your current resources. So, and feel free to select all that apply. And if one of the options is that isn't listed, please let us know in the chat. Thank you. Thank you. Great comments in the chat. Very helpful. Okay. Okay. So lots of you guys are making them yourselves. Okay. Thank you for letting us know. And hopefully, then the resources you're hearing about today at MCRC will be helpful to you. So I think with those polling results, I'm going to be passing the mic over to Kim to get us dived into learning about Media Campaign Resource Center. Kim?
Great, thanks, Renee. Next slide, please. Go ahead, one more. There we go. So the MCRC is an online catalog of tobacco counter-marketing advertisements developed by state health departments, nonprofit health organizations, and federal agencies, including CDC OSH. MCRC licenses these existing creative materials to state, local, tribal, and territorial health departments and partner organizations to save you time and a high cost of producing new ads and materials. And as we saw already, about a third of you are using MCRC, so that's fantastic. MCRC is part of OSHA's, the Office on Smoking and Health, our health communication technical assistance offerings. In addition to providing access to these materials, we can also provide evidence-based technical assistance to help you select ads that are appropriate for your campaign goals. And we can also provide tagging services for a reasonable fee. MCRC, as I said, is a program of the Office on Smoking and Health, and we operate it through a contract with ICF Next. Now, Susan Arhus, our MCRC administrator, will walk you through the MCRC platform. Susan?
Wonderful. Thank you so much. I'm going to go ahead and share my screen. And we're actually going to do a live walkthrough of the system here together. Let's see if it's going to find the right one. I think so. Very good. So hopefully what you're seeing on your screen now is a live view. I'll just move it a little bit to make sure that we're all looking at the same thing, of the platform, the Media Campaign Resource Center. It is accessed through the CDC website. So it's a sub site on there, but we're actually going to go ahead and drop a direct link to it into the chat right now so that you can go ahead and click on it and bookmark it for yourself right now, and then you won't have to scramble around for it later. And we'll also talk about how to go ahead and apply for an account. So there it is, the Media Campaign Resource Center. As you can see right there across the top, it's telling you that the MCRC is currently under maintenance. So we have been in the process of a fairly large maintenance upgrade this week. And so we want to let you know that just in case you find any errors or bugs while you're in there, do let us know. You'll be able to see our email address in a couple of places. You can see it right there, actually, mcrc@cdc.gov. If something doesn't seem to be working for you, please do let us know, but it should be resolved within the next couple of days. We're hoping that the maintenance will be done, but there it is, and you can see a nice description of what it is and how it's used. And the things that you'll see here on the main screen are some quick links to common search topics, featured ads and campaigns. These are sort of ways that we sort of try and predict what you might be looking for when you come in. So we've provided some samples already of how you can quickly access the data. So examples of pre-programmed quick searches on the page include free ads, you'll see over here, and ads that are brand new. So if you become a frequent user of the MCRC and you're just sort of wondering what's new in there, one way to access new items would be just to click on that link right there from the home page. It's a quick way to dive right into the collection, and some other ways you might do that would be to use things that you're seeing popping up along this moving carousel. And we try and keep that fairly fresh when things are new to this collection or recently released or of note based on something that's going on in the news. For instance, we might be able to drop in a new one here. So this should be an ever-evolving list of new and interesting things that you can click on. You'll see here a link to what we've referred to a little bit already, something called the Tips from Former Smokers campaign from the CDC, which has a lot of wonderful free items you'll be able to use in your campaigns, and you'll be able to see some examples later on. You can also, of course, just like any website, enter a term directly up here. If you know the name of an ad you're looking for, you can enter it right in there. Or if you just want to see everything available and you just want to shop around, you can go ahead and hit browse the collection and you'll see literally a list of everything that exists. We are actually going to start by, actually first let me just tell you how to register and then we'll go in and look at some ads together. I'm already logged in, so you're not seeing the word register. But if I were not logged in, right up here in this upper right-hand corner, you would see the word register. You can click there. It'll ask you a few questions and then let you apply. And it's just important to know that that's not automatic. We do approve accounts for the MCRC, and there are a couple of reasons for that, mostly because we do distribute materials that are copyrighted and have property rights and talent use associated with them. And so we can't sort of just have people downloading things without kind of knowing who you are and how you're going to use it. It's important that we protect the materials that have been donated to our collection. So the reason that's important for you is you might be on a deadline and think that you can come into the MCRC and apply for your account and download something the same day. And it isn't going to be quite that quick. So give yourself a day or two to apply. We'll approve you and we'll get you going on your way. Now, I have been using the word download, but it's important for you to understand that there's no self-download in the system. You will be ordering from us, so you'll order, and then we will actually send you a download link. So that part is not automatic either. Again, just in terms of budgeting your time for knowing how long it'll take for us to send you what you need. So I want to go ahead, since most of us are looking for low budget items, we want to save all the money we can. We like to go ahead and just highlight our free ad link, what a lot of folks will probably choose when they're entering the system. You'll just have to give it a minute to think about it, and there it is. So what we're seeing now is, you can see right up here that that's the filter that we're using. It kept that when we came to this screen. So all you're seeing now is a list of free items, and there are 663 of them. So plenty of free items to choose from. At the moment, the system is presenting those to you based on what it thinks is the best match, but there are a couple of other ways to sort what you're seeing. You can sort by title, you can sort by the year if you're looking for things that are new or old. Just some things to, other ways to sort the results that you're seeing here. You might know already sort of what you're looking for. You might know what kind of format you want, for instance. And so you're going to see there are lots of other filters over here where you're going to be able to sort of filter out the things that you want or don't want from this list. And I just wanted to show you quickly before we do that, that at the moment, these are organized by the number of items that fit that criteria. So there are more print items than anything else. So it's got that at the top. And that's no big deal when there are only a couple of choices. But when you come down here and you're looking at themes, for instance, it's a little bit harder to have them not alphabetized, right? So I just wanted to show you that you have an option here to switch from the numeric view to an alphabetical view. So that will help you if you know, for instance, that you're going to be looking for, as we might be today, youth prevention. It's a lot easier to find that when it's at the bottom of the list rather than having to hunt through there. So there's just a couple little tips about how to navigate this site. So because we predicted this, but now we have it confirmed that a lot of you are working in youth prevention, we want to go ahead and use that as a sample for a way to kind of dive deep into the collection. So rather than going back to the main screen, we're just going to go ahead and remove that free filter, and we'll give it a second to think about that. And it's actually going to now just remove all filters and give us a view of everything in the collection. You'll see that there are 1,037 live items in the collection. In fact, there are many more than that because under each one of these catalog records, there may be multiple sizes available or multiple languages of each of these items. So there's really quite a bit more in there. There are also quite a few more items than that in our full collection under what we call our archive. If you were to choose from current to archived, you'd see a whole beautiful history of tobacco prevention materials, but those are essentially there for you to view and get caught up on what the history is, but really not for ordering because they're generally speaking out of date or unavailable or don't sort of meet the current science. So we request that you stay in the current catalog when you're ordering. So we know, I'm going to go ahead and just use some of these themes now. Some other ones that you might be looking for. Campaigns is a popular one. If you know you're looking for tips from former smokers, or you've heard of a campaign that a certain agency has done, you can find it there. Languages obviously is another one that will be very popular. You can see how many items we have in different languages. And then target audience, of course, depending who you're trying to reach. That's going to be another one. Produce for is a place where, again, if you've heard, oh, I heard that the American Lung Association, for instance, or the state of Alaska had a really great campaign, but I can't remember what it's called. If you can remember who you think created it or submitted it to us, you can find it there. So those are some of the major filters. We know that you all are working quite a bit in youth prevention, so we're going to use that as our sample today for a theme. And since we're talking a bit today about social media, we kind of think that that's a place where folks will be spending a good bit of time. We're going to go ahead and actually, I want to talk about this for a second. I was going to go ahead and click on this social media materials to limit it further, but I am kind of seeing as we're talking that a lot of these materials, well, they're really split, aren't they, across all the different kinds of formats. So before I click that, let's just go ahead and look through here a little bit just to see what's available. So these are all things marked for youth prevention. And you can see right here, you'll be able to see what they are, what kind they are, right here in this little summary. So out of home would mean things like posters and billboards, anything that you would see when you're walking or driving by something when you're not at home. Digital display might be web banners, as we used to call them, things that that you would place on the web, but not necessarily for social media. And we can kind of talk a little bit more about that if folks would like to understand kind of the difference between those. Some radio ads, and I'm pretty certain there's at least one video down here lurking at the bottom. So lots of different things available. You'll see that a lot of these some of these are from a recent campaign from the CDC. So if you start to see sort of a theme, you're like, these are interesting. I'd like to see everything available in this particular campaign. There's a way to click on that. You can see that this is a live link. So everything that was created at the same time as this item within that same campaign would be able, you'd be able to view that by choosing the campaign, and then you'll see all the different things that are lumped together in that campaign. So lots of ways to click back and forth and see the different items available. So we're going to go ahead and choose a few and put them in our basket. I am actually going to choose 2 different formats just so you can see the difference that makes when we go ahead and do, when we check out using our shopping cart. And I want to make a quick comment here. Most of the items we're going to see in this particular category and on this screen are free. You see that because it says cost free here in the summary. Not everything in the system is free, and you may find an item that it might either have an actual price tag, or it might say unknown, or it might have a range of prices, and you may be interested in using it, but you really are sort of curious, how much that would cost before you order it. And I just want to mention really quickly that when we go through the checkout process using our little shopping cart up here, even if it says that that material is going to cost $20,000, you are not going to owe us a single penny just by checking out. So going through the process of checking out tells us that you're interested in the items, and it lets us kind of start a dialogue with you about your use of the items and potentially how much they might cost you. Keeping in mind that it might cost something different for you than it would cost, the New York City Department of Health to run that same item for a year in their area, and maybe you're just running it for a week or two, on the internet in your area. Those would be 2 very different prices. So really all I'm going to tell you about that today is not to be afraid to check out. If you just kind of want to check with us how much something might cost, go ahead and use the checkout system and we'll talk to you about it. And then once you've kind of confirmed the price, you can just say, you know what, never mind, that's too pricey for us, or sure, we're going to go ahead with that. So no need to be nervous about that. So I'm going to go ahead and grab a social media item. I'm trying to scroll slowly. You can get a little bit seasick when you're watching someone else scroll around on the screen. So I'm going to try and prevent that. I'm going to go ahead and grab this e-cigarette aerosol social media item developed by the CDC. And as we go in here now, we've clicked into the catalog record itself. You'll get a little bit more information about what's available. You can see that this one comes in both English and Spanish. It is free. You'll get a nice description of the item, and you're going to see here that it's available in multiple sizes. So most of our digital and social items are delivered, not all of them, but most are delivered as a bundle. So in this case, you may add this particular item to the cart, and when we deliver it to you, you may in fact get all the different sizes. That's not always the case, but we try and make it easy for you. And it should say that in the description if it's part of a bundle. So in this case, let's go ahead. Oh, we can see that there are 2 different sizes. There's your Facebook size and there's your Twitter size. And then there are the Spanish versions as well. So I'm just going to go ahead and put the English one into our cart. Oh, and it logged me out. Darn it, I logged in too early today. Let me see if I can manage to get my password in correctly here. Stand by. Okay, all right. Unfortunately, I am now going to have to grab that item again. So items do stay in your cart, but I didn't get it into my cart before my time logged out. So let me just grab that again. We'll grab a different one. Here we go. All right. Now you get to see a new example. There's your Facebook and Twitter samples, and I'm going to add that one to my cart instead. Great. All right. I know there's something else that I want to add, so I'm going to go back to the search results. And I know that what I want to show you is from the You Are the Target campaign. This one is out of the state of Maine. I wanted to show you this one because social media, of course, as we all know, means a lot of different things these days. And it's not just a series of individual posts or static posts that you add, and I know I'm running out of time shortly, to your website, but it might actually be a video or some other item. So in this particular case, I just wanted to show you this really nice set of videos that are available and designed for social media out of the Maine Health Department. And I won't play it for you, but it's just a nice quick little 6-second video. And in this case, this is a bundle. So if I order this item, you're actually going to get a series, I think it says it up here in the description, of 5 6-second digital and social media videos. So these are intended for social media, and you can add those to your cart. We're running a little short on time for me to be able to show you a full checkout, but I just want to show you what the cart looks like. So you can see that it's going to ask you a few questions once you proceed. There's my timer telling me that it's ready for me to send you back to Kim. But I just want you to know that it's going to ask you a couple of quick questions about how you intend to use the items. And those are really, it's a chance for us to do good reporting on who's using the items so that we can tell our donors who send the items how they're being used. But it's also a way for us to kind of help you. So if you tell us that you're going to put these on social media, for instance, I'll just give you an example. Some items on our platform are really only intended for an adult audience because of the content of the ad. So if you were to write in here that you were doing a youth-based audience, a youth-facing audience, and you were going to put it on Facebook, for instance, or Instagram maybe, we'd be able to tell right away that maybe there's a little red flag there that might not be the best choice of ad for that audience. And we might just start a quick dialogue email with you to just talk about how you want to use that, or if you have kind of a way to do some, some targeted marketing to avoid that particular ad being exposed to children, that kind of thing. So the more information you give us here, there's no right answer to these questions, but the more you can tell us about what you're planning to do, the more we can help you, develop a really solid campaign. So I'm going to stop there. I'll leave this open in case, people have some really intense questions about ordering and want to come back to it later. So let me stop the share. And we do have a moment as we're kind of transitioning back to our slideshow. If people do have questions, I see a lot of things in the chat in the Q&A, but maybe one of my colleagues could shout out if there's a question that's really relevant right now that I can address.
Thanks, Susan. Yeah, we do have a bunch of questions, and I think we'll just hop into a few of those right now.
Okay.
Thanks so much. That's a wonderful demo. So the first question we had was from Vera Mangrum. I hope I've done justice to your last name there, but she wanted to know if the materials in the MCRC are evidence-based, and I think Renee is going to handle that.
Great.
Question.
Thank you, Robin. Yes. So thank you so much for the question, Vera. Really good question to ask. So most of the materials in the MCRC are considered evidence-based. The majority of the materials housed in the collection are from the Centers for Disease Control and Prevention. All the materials that we produce are evidence-based. And then many of the state and partner produced materials in the collection are also evidence-based. So what we really, encourage you to do, as Susan was talking about, when you're ordering materials and we're asking you about your campaign strategy, seeing what you put there helps us determine, potential recommendations based on, if we see you, for example, ordering something that we would think maybe doesn't meet necessarily the goals of your campaign, then that would flag us to want to talk with you about that. And then we could recommend a different ad material. And we also, as a part of that, we also recommend to the extent that you can, and depending on what, the media activity is that you're doing, but we'd recommend testing. So who is your target audience, and is, the material that you're getting from MCRC going to resonate with them? And the best, way to know that is to test it with them. And if it resonates, then you can use it. And so we've got some guidance, some resources to help you with testing ads. And I think Kim is going to probably talk about that next. But Vera, do let us know in the chat if that was enough of an answer to your question, or if you have any further follow-ups. And I think pass the mic back to Robin to continue us into some more Q&A.
Great. Thanks so much, Renee. Another question that was posted is, what is the most recent version of the best practices for comprehensive tobacco control programs that Renee mentioned earlier. 2014, yes, that is the latest version of that. And but I will also point folks to the best practices user guide that Renee also mentioned for health communications and tobacco prevention and control, which is more recent. So those are the two documents that we recommend you taking a look at, both the best practices guide from 2014 and then the user guide that's specific to health communications. Another question that was posted was whether there are materials that can be used on TikTok in the MCRC collection.
I think I might pass that one to Susan.
I was afraid of that. That's a great question. That is a great question. As a mother of two, teenage kids, I'm curious myself. That is not what really the only two items that are called out by format or size right now are Facebook and Twitter. That doesn't mean people aren't using items all over the place. It's just not things that are consistently, traditionally maybe sized. Like for many years now, we've been sizing things for Facebook and Twitter. So as new platforms come on and their sizes become standardized, the CDC collection, I'm sure will slowly morph into whatever the newer, most popular sizes are. But many items in the collection, especially if they're a CDC item, can be resized to fit a new platform if it's not fitting already. I've not had someone come and tell me that things aren't working on TikTok. Excuse me. So you may have to just experiment a little bit or do some research and reach back out to us to say, can XYZ item be, fit to this size? We do have obviously a rule that we need to go back to any submitter to request if somebody wants to adapt an item. But many of our submitting states are willing to allow certain adjustments of their materials. So it's certainly worth a conversation, but I will say it's not a standard size or format that you'll see listed.
Great. And one last question before we move along is a question about placing a logo that comes in. This is in the chat box actually from Alicia, right? Whether you can place a logo on material that's in the MCRC.
Yes, and I was going to mention that when I got to the final checkout screen, but I timed myself out, so I didn't get to it. So I'm glad you asked. And you'll see an example of it a little bit later today, where we're going to show you how Tobacco Free Nebraska placed their logo on some materials. And yes, we call that tagging. It's definitely allowed. There are some rules around it. So as you're checking out, you're going to get a chance to say whether you'd like us to help you tag it. And there's just a small fee for that. Or if you're going to tag it yourself, and we can kind of dialogue about best practices around tagging. We also offer lots of training in the MCRC we're going to mention later, and you can come take an actual video course on how to tag. It's less than 10 minutes. So you could kind of learn more about that. Mm-hmm.
All right, so I think it's time to bring back up the slides.
Yep, and while you're doing that, I'm going to make one super quick announcement. I'm going to drop something into the chat for you because I was so excited to hear how many folks are developing their own social media items. And I want you to know that you can consider donating those or submitting them right back to the MCRC. So you can be featured on, another webinar where we show your great work, and we'd love to share what you're doing with other folks. So I'm going to drop an interest form into the chat, and you can fill it out if you'd like to donate your items. Thanks.
Fantastic, Susan. That's great. I'll stay off video, folks, to preserve my bandwidth, but hopefully you can now see the slides. And we've worked with Susan. We've learned how to find things in the MCRC catalog. But how do you know which are the best ads to choose for your campaign? So we're going to talk briefly about what to look for when you're selecting selecting an ad for your campaign or your communication efforts. Next slide. So Renee mentioned the health communications user guide earlier, and the information that I'm going to present today is covered in much greater detail in these resources, and particularly in the CDC OSH guidance document, considerations for creating and placing mass reach tobacco counter marketing ads. And we'll be sending out that as a handout after the webinar, so you'll get that. And so, but by the end of this section, we hope that you'll have a better idea of what an effective ad looks like, and that you'll be sensitive to the issues that could potentially weaken the effectiveness of the ad. And all of this will help you as you're shopping the MCRC and selecting ads. Next slide. Great. The best way to be sure that your campaign has a chance of achieving your goals is, of course, to pre-test your ads with your target audience, as Renee mentioned earlier. The ad that you may like or that captures your attention in a certain way, well, it may not have the same effect with your intended audience. And so the best practices user guide that we showed you a moment ago on health communication, it has information on pre-testing ads. And then there's also a guidance document that we'll share that has called sample formative testing questions, and that provides you with evidence-based questions that you can use in your own pre-testing. Now I'm going to talk about types of things that can make an ad effective or ineffective. And these are the types of things that you'll want to look for and keep in mind as you shop for ads in MCRC and in your pre-testing. Next slide. Okay. So the next 5 slides, that will cover considerations, and these are relevant to all ads, whether you're promoting cessation, prevention, or reducing secondhand smoke exposure. I do want to mention that there are considerations for specific types of ads, but for today, I'm just covering considerations for all types of ads. You can find out more about considerations in the considerations guidance that we've mentioned already, and we'll share with you. First, ads with messages and images that elicit strong negative emotions are effective in changing tobacco-related attitudes and behaviors. Strong negative emotions, that includes things like anger, resentment, fear, loss, sadness, or disgust. Emotionally intense ads have a number of known benefits. They may elicit fewer counter-arguments. They achieve higher recall. They are effective with audiences who are experiencing tobacco-related disparities, such as low socioeconomic status, some racial and ethnic minorities, and youth, which is a focus for most of you today. Message formats that are especially good at eliciting negative emotions are graphic portrayals of the health consequences of tobacco use and testimonials. Messages that counter deceptive marketing, when used in conjunction with a health message, they're also effective. These ads may be especially effective among youth most receptive to cigarette advertising. Next slide. Okay. An ad should support each key message with a credible fact or persuasive statement. Doing this helps the audience better understand what you're telling them and why they should believe it. In commercial advertising, this statement or fact is called the reason to believe. An example of this is when you make a statement such as, everyone has the right to breathe clean air. This message will be more convincing and clear if you back it up with a supporting fact, such as secondhand smoke contains about 70 chemicals that cause cancer. Next slide. Okay. Ads should also include a call to action. Including calls to action in hard-hitting ads can reduce the likelihood that viewers will have avoidance reactions or dismiss the key message. Calls to action can be things like providing a quit line number, or a website address, or suggesting a change in behavior, such as talking to their health professional or making your home smoke-free. Ads that get viewers to talk about the campaign can increase the campaign's reach and effect. In fact, studies show that smokers who report conversations generated by anti-smoking ads are more likely to have recently tried to quit, and non-smokers are more likely to report support for tobacco control. For ads in MCRC, your call to action will more than likely be in the taggable space of the ad. If you're not planning to use a federally produced ad that will already have a nationally applicable call to action, like call 1-800-QUIT-NOW, then you'll want to think about what your call to action will be as you're shopping to make sure the ad has taggable space for that. Next slide. Strong ads simplify messages and visuals. One main message is ideal. 2 to 3 would be the maximum to communicate. In general, out-of-home ads require the fewest words, then TV ads and videos, then radio ads, then print ads. Also, you want to avoid ads with messages that are too clever, too subtle, or too sophisticated. Strong arguments against smoking are more compelling and effective than clever tricks like a loud noise or an unexpected twist. Ads should use clear, plain language so people can understand messages quickly and easily. And in addition, make sure the ad's visuals match and support its messages. And as you can see on the slide, CDC has a number of materials to help you assess an ad's language and its visuals. And those links are shown here, and you'll have a copy of that this presentation. Next slide. Of course, we are all looking for ways to maximize the effect of limited resources. And research has shown that strong ads can be effective across many audiences. By featuring a variety of people in your ads from different racial and ethnic backgrounds, you can make them more accessible to broad audiences. Specific audiences can then be targeted via tailored media placement. This is true, of course, as long as each audience, particularly those experiencing tobacco-related disparities, is sufficiently exposed to the campaign. The tobacco companies are masters of this strategy, and you can see that in these ads. This is from the Virginia Slim campaign that was run by Philip Morris in the mid-1990s. These ads include multicultural models and nuanced messages and images that can appeal to a straight general public audience while also resonating with LGBT communities. And in fact, Philip Morris placed these ads in both mainstream as well as LGBT-oriented magazines. Next slide. So let's talk about youth prevention ads. I know that's important to most of us here. Young people respond well to the same key messages as adults about the health effects of tobacco use and secondhand smoke, and about the deceptive marketing practices. We are fortunate that there are several national media campaigns that reach youth with tobacco prevention and cessation messages. The FDA's Real Cost ads and the Truth Initiative's Truth ads are effective, evidence-based campaigns that your kids are probably seeing. Adults aren't always aware of these efforts, as the ads are being placed in channels that are popular with youth and young adults. Next slide. When thinking about youth prevention ads, again, it's instructive to learn from the tobacco companies. In this case, though, we want to avoid ads that use their approach. Let me show you what I mean. Industry prevention ads, like the ones pictured here, with explicit behavioral directives, for example, don't smoke, or that portray smoking as an adult-only behavior, they may actually increase youth smoking prevalence. These industry ads avoid depictions of the serious health consequences, and they instead focus on messages like about peer pressure and decision-making skills. Not surprisingly, evaluations of the industry's prevention ads consistently show that they are ineffective in preventing tobacco use amongst youth. Next slide. I do want to call your attention to a few caution areas. These elements are not automatic disqualifiers. They can be included in ads if you handle them appropriately. However, they are a sign to stop and pay closer attention, and definitely something you'll want to check out in pre-testing of an ad that you're thinking about using. First, studies have found mixed effects to including smoking cues in ads. Now, smoking cues, that includes images of cigarettes and e-cigarettes, and showing smoking or vaping related materials like ashtrays, matches, and lighters. If an ad includes these smoking cues, the argument strength of the ad must be sufficient to overcome the potential loss of persuasion created by the smoking cue. The CDC guidance document on smoking images and counter-marketing ads has more information and has questions you can use to test argument strength of an ad. Also, humorous ads are generally less effective than serious ads in motivating smokers to quit. That said, some ads have used the humor effectively to show empathy for smokers. For instance, California's Quitting Takes Practice ads, and some truth ads have used what we call dark humor effectively to elicit a negative emotion. Examples would be Body Bags ad and Don't Always Die from Tobacco ads. When an ad uses humor, you want to assess whether that use of humor is confusing, offensive, or distracting from your overall message. Celebrity ads can be problematic. Downsides of using celebrities include potential behavior that compromises their ability to be an appropriate role model, and then lack of credibility among viewers who will just assume that the celebrities are being paid to act in the ad. Lastly, repeating information to debunk or clarify an incorrect claim can create what we call belief echoes that reinforce the original misinformation. This belief echo persists even when the audience believes, understands, and recalls the correction. So hopefully these tips will help you get started in selecting your ad. And now my colleague, Amy Lear, will share other CDC and OSH resources to support your work. Thank you, Amy.
Awesome. Thanks so much, Kim. Hi, everyone. Hope you guys are doing well today. We can go to the next slide, please. So if you're planning to do some e-cigarette youth prevention work, we have two campaigns in the Media Campaign Resource Center that you might be interested in. The two are Know the Risks, which are the far right images, and Protecting Young People from E-Cigarettes, which are the two left images. The ads in these campaigns highlight how e-cigarettes have the potential to cause lasting harm to the health of young users, especially their brain development. Both campaigns include a radio ad and multiple social and digital display items. Know the Risks also has a TV ad called Any Volunteers. It's important to note that all of our e-cigarette materials are targeted towards adults who are parents or work with or influence youth. Youth are not actually the intended primary audience for the CDC developed e-cigarette creative. Next slide, please. In addition, if you're looking for more information about e-cigarettes in youth, please take a look at the CDC OSH webpage. It's called Quick Facts on the Risks of E-Cigarettes for Kids, Teens, and Young Adults. Not only does this have extensive background information on the risks of e-cigarettes to youth, it also provides fact sheets and a presentation deck to educate youth and links to a variety of other evidence-based resources you can use with parents, healthcare providers, and educators who work with youth. Next slide, please. The FDA and Truth are also running national prevention campaigns that are youth-facing. You may not be seeing the ads as you aren't the target audience, but the youth in your community have probably seen these. The FDA makes some materials from their youth prevention campaigns available for free through its FDA Exchange Lab. Next slide, please. So 2021 marks the 10th year of the TIPS campaign being on air. The TIPS campaign profiles real people who are living with serious long-term health effects from smoking and secondhand smoke exposure. The campaign places ads on national television and via digital and social media channels with an emphasis on reaching lower socioeconomic status smokers ages 18 to 54. And during 2012 to 2018, CDC estimates that more than 16.4 million people who smoke have attempted to quit, and approximately 1 million have successfully quit smoking because of the Tips from Former Smokers campaign. Research has also shown that TIPS is effective across subgroups of race, ethnicity, education, and mental health. So when you work with the TIPS campaign materials, you're using materials that are evidence-based and have been shown to be effective with many target audiences, especially populations experiencing disparities in tobacco use and tobacco-related health conditions. We have TIPS languages available in a few other languages, and we've worked with groups in the past to translate items for their audiences. So that's always an option if there's a language that you would like something to be translated in that we don't have readily available, we can translate it for you. In addition to cessation, the campaign also includes several secondhand smoke ads. Next slide, please. And then one last mention related to TIPS, just to make a quick plug for more free resources you can use. On the TIPS campaign website, which is separate from the MCRC, we can drop the link in the chat. We have a series of pages for specific groups of partners you may be interested in working with, including faith-based organizations, healthcare providers, organizations serving military members and veterans, organizations serving public housing residents, and public health professionals. These pages have background information, suggestions for activities, and links to free TIPS resources. You can syndicate almost any of the TIPS website content for use on your own site. And when you syndicate our content, it will update when we update our site information. You can also place free TIPS buttons on your web pages that link to the TIPS website where visitors can read personal stories of what it's like to live with smoking related illnesses and find resources to help them quit smoking. Next slide, please. In addition to the TIPS campaign materials, the Office on Smoking and Health has also developed a variety of short videos, infographics, and other resources to help support cessation through earned social and digital media efforts. You can find all of those resources on the OSH Cessation Resources page. Next slide, please. And almost all of the CDC developed items are free in the MCRC. Sometimes TIPS videos will have a cost depending on how you plan to use them, but they're mostly in cycle. And in cycle means CDC has paid the talent fees for the videos, so they're available to you at no cost. You only need to pay for placement. The Quitline videos, social media, e-cigarette, and all TIPS digital display, print, and out-of-home items are all free. And to find free items, you can search by cost. And to find in cycle or discounted items, you can search by ads in cycle. So within the MCRC, you'll see a screenshot here. There's a red button that's free. And then you can also do in cycle just to filter those so that you can see them. Next slide, please. One low-cost resource to support evidence-based health communications is to use content and promote resources from the CDC OSH website. The CDC OSH website has a wide array of resources and information you can use in your media and communications efforts. Refer to the site for the latest evidence base on a variety of tobacco control and prevention topics and target audiences. Next slide, please. One section of the site has a collection of infographics and social media images on different tobacco-related topics. Infographics are great for posting on your own websites or for sharing on social media profiles and blogs or newsletters. The images you see here are from the Secondhand Smoke collection, and there are also infographics on adult tobacco use, health effects of tobacco use, and youth tobacco use. Next slide, please. So social media is also a great way to extend the reach of your campaign messages. The best way to get started is by following our social media platforms, which is CDC Tobacco Free. These will keep you up to speed on tips and other OSH activities and resources. You can engage in the conversation and share and repurpose all of our social media posts. You can also use our previous images archived on our social media pages. So the images that you're seeing on this slide are from the CDC Tobacco Free Facebook page. And they're easy to find once you're on there. And remember, you can also order social media items through the MCRC, and you can share what we post so that it appears on your own page. And with that, that's it for me for the CDC developed materials and other OSH resources. And I'm gonna hand it back over to Susan. Susan?
Very good, thanks, Amy. And I just wanted to give a quick shout out to let folks know that since the beginning of this webinar, we have gotten 11 new applicants for accounts with the MCRC. So keep it up, you're doing great. I think we can break 20 before we log off today. So I will, at the end of this webinar, be going back in to approve you. So that is fun, thank you. And let's see this, yes, okay. And someone on this website, on this webinar is going to recognize this screenshot here. So Ashley Wolf from Nebraska, if you're still out there, thank you so much for inadvertently letting us use these items in this presentation. Ashley recently gave a terrific presentation on another MCRC training where she was our guest speaker, talking about how she as an MCRC user finds things helpful. So you'll see some of her work here today. So we want to close out today with a sample of how a state built a cessation campaign using materials from the MCRC. And while there are many effective and quality items available in the collection, as we talked about very early on in this session today, it's most important to set your campaign goal first and then seek materials that help you reach that goal. So in this case, Tobacco Free Nebraska wanted to promote the Nebraska Tobacco Quit Line. So you're also going to notice, as we talked about earlier, that you're going to see their logo on quite a few of these. Nebraska found ads to run on television, on public transit, in print, and to use in social media, and also on some digital channels, I believe. They use tips ads and ads developed by the state of Alaska and Clearway, Minnesota. They found ads for specific audiences that they were particularly interested in reaching, such as people with behavioral health issues, rural chewing tobacco users, and new parents. They worked with the MCRC with us to place their logo and quit line number on the ads. As we talked about before, this is called tagging. And as you've seen a little bit of comments in the chat, we are able to tag for you. And we're also able to do some amount of resizing for you. Both of those services are available at the low cost of $85 per ad. And we were also able to talk to her about recommendations and best practices for what makes an effective tag. It can be quite difficult or different depending on which kind of ad you're using. Oh, thank you for switching. So you can see how that tag shows up differently depending on the different items. Actually, if you can go back one, Brittany, folks can see the animated ad from Clearway, Minnesota, the No Judgments Angie ad. You can see how here it's integrated right into the animation of the ad, and that tag shows up on the billboard. So that would be an example of the most complicated version of tagging. And then you can go forward again and you can see that for the most part, there's a very obvious and easy place available for you to put not only your logo, but maybe your quit line number or your website. And even on TIPS campaign materials, you're able to put in your own website and your own quit number or whatever phone number you're looking to drive your calls towards. So we make them as usable and taggable as we can, and are happy to work with you to do your customization however we can help. And I'm going to bring that back to Kim now for our wrap up.
Okay, great. Let's go ahead and next slide. Next slide, please. Thank you. So we know this has been a lot of information, and we want to be sure that you know where to go after the webinar if you need more help. So I've got a few things on the slide. We'll talk about the video tutorial series on the next slide. So let me tell you about the rest. So at least once per year, we offer an MCRC 101 webinar, which is really similar to the content you've seen today. But we also offer special topics webinars. I think Susan mentioned this in her presentation on topics such as tagging. And so when you go and register today on MCRC, you'll get an email when we offer those upcoming webinars, so you can learn more about those topics. Next, when you go to the MCRC, you'll notice at the top of the screen up at the right, there'll be a help section. And within that help section, there's an FAQ, frequently asked questions section, and you can go there and your question may already be answered. If it's not, you can always reach us by email. You see the email on the screen, mcrc@cdc.gov, and we'll be happy to help you in any way. You may need more general campaign strategy support, and we do have an email address where you can reach our technical assistance team, and we'll put that in the chat, but that's oshcomta@cdc.gov. So we want to help you with whatever your needs are. Next slide, please. I mentioned we had those video tutorials and tip sheets, and those are on the MCRC. And what you'll do is you'll go there, you'll order them by placing them in your cart, and then those will come to you. Or you can just email us directly, and we'll send those to you. But those will help you. You see the topics there. Those will help you as you're ordering your ads. Next slide. Lastly, if you're looking for help developing or evaluating your social or digital media efforts, Social Media at CDC has a variety of resources and guidance tools, including the Social Media Toolkit and CDC's Guide for Writing for Social Media. And so with this slide, that wraps up the main topics that we'll cover today. We hope that you found this helpful. And we've already mentioned that we do webinars on deeper dive topics. So if something came up today for you that you'd like more information about, feel free to drop that in the chat. Let us know so we can plan around that and help you out. Next slide. I want to say thank you for inviting us to present today on the ways that we can help with your media and communication efforts around tobacco control. And we hope to see you shopping the MCRC, following us on CDC Tobacco Free, and browsing our resources on the website very soon. And now I'm going to turn it back over to Brittany to help us with any questions that have come in that may not have been answered in the chat.
Thank you all so much. This has been so informative, and I've seen so many great things coming through in the chat box and so many great links. So wonderful. Somebody, Kelly O'Connor asked, is there one location for all the additional information here in the chat? So if the folks at the CDC, if you can send us, as you've been dropping chat, if you've been dropping links in the chat, if you send us all of those links, we'll make sure that they're posted with the resources on the website. Again, those will be the slides and any other resources that we're providing will be on the CADCA website and on the GEO website once we get those from the folks next week.
Right, Brittany, and I just wanted to point out that in that deck that we'll be providing, the links that we've been dropping into the chat box today are all contained within that deck.
Oh, great. So yes, all of the links and the things that have been provided, they will be there for everyone. Are there any other questions? I don't see anything that hasn't already been answered in the Q&A box. So I want to take this opportunity for folks to drop some more questions if they have them. And while you're doing that, I'll just do a couple of quick wrap up things. A quick reminder that the webinar recording will be distributed. We'll send out an email tomorrow, and along with that will be a short evaluation for the webinar. So please make sure to fill that out. If you are looking for a letter of participation, you'll be able to find that after you complete the survey. You'll see a link to view and download it from the thank you page of the evaluation. You have to download it right after you fill out the evaluation because you won't be able to go back and get it later. As I mentioned, the recording will be on the GEO website and on the CADCA one. And I don't see any other questions that have come through.
Brittany, I wanted to flag
yeah.
something that somebody had posted in the chat box and that was answered in the chat box, but it might be a question that other folks might have and they may not have seen that exchange.
Absolutely.
And then it was a question about resizing, which was posed. I think a couple of different people kind of asked a question around resizing, and Susan answered in the chat box. And I was wondering, Susan, if I can cue you back up again to verbally share what you did in the chat box about resizing.
Sure. And the challenge with resizing is just that in order for customers to be able to resize, we would have to send the native files of an ad, right? The completely unlocked editable files. And our submitters, including the CDC, ask us not to distribute the native files. So resizing really is a service that the MCRC does need to provide. It's just $85 per ad. If you were doing a large number of them, we certainly can discuss a bulk rate for you. We try and make it as affordable as we can. But tagging, where you're putting your logo, your phone number, your URL onto an ad, that can be done yourself. We send you it's a locked up ad, but it has that space available for that tag to go. So that one we can do for you, but we don't have to. You can tag yourselves. The other small little caveat to resizing is if a submitter from a state or partner agency, not the CDC, has sent us something and they haven't even sent us the native file, we may have to go back to the original submitter to get additional files. So all that to say, do budget a little extra time if resizing is going to be part of your ask.
Great. Thank you so much.
Mm-hmm.
Anything else that we want to address from the chat box or from the Q&A box? I don't see anything new that's come through yet. Tim asked, how long does it take to get MCRC access for the request to be approved?
I am literally going to go approve them right now when we get off of here. As we mentioned, we did just have this new upgrade to our system, so I'm a little slower at it today than I was last week because it's a new screen, but I'm doing it right now. I'm actually working on one of yours right now. The lucky winner will be approved very soon. So give me about an hour and we'll get you all approved. Usually it's a day, but right now I'm going to work on it.
So minutes, it sounds like, Tim.
Today minutes, tomorrow
Today minutes.
Maybe not so fast, but give us a day or two at the most.
Great. Well, if nothing else is coming through, I will just take this time to say thank you so much to our presenters for this wonderful presentation on health communications and all the available resources that are available from CDC and from the Office of Smoking and Health, and really for your commitment to providing these relevant and just current material to our audience. And thank you everyone for participating, for your comments and your questions and your insights. And make sure to look out tomorrow for that email with the evaluation link and the recording. Thank you so much, everyone, and I hope you have a wonderful rest of the week.